Welcome, and thank you for joining us. Today we're talking about something almost everyone has in their medicine cabinet, ibuprofen. It's one of the most commonly used pain relievers in the world. Headaches, back pain, muscle aches, fever. Ibuprofen is often the first thing people reach for. Because it's sold over the counter, many assume it's completely safe. But what you don't know about ibuprofen could affect your stomach, your kidneys, your heart, and your long-term health. Let's start with what ibuprofen actually does. Ibuprofen is a non-steroidal anti-inflammatory drug, or NSAID. It works by blocking substances in your body called prostaglandins. These chemicals play a role in pain, inflammation, and fever. By reducing prostaglandins, ibuprofen helps relieve pain and swelling. However, prostaglandins also protect important organs. They help maintain the lining of your stomach, support healthy blood flow to your kidneys, and help regulate normal blood clotting. When these protective chemicals are blocked too much or too often, side effects can develop. One of the most overlooked risks of ibuprofen is damage to the stomach and intestines. Ibuprofen can cause stomach irritation, ulcers, and internal bleeding. The risk increases with higher doses, frequent use, taking it on an empty stomach, drinking alcohol, or combining it with other NSAIDs, such as naproxen or aspirin. In some cases, stomach bleeding happens without obvious warning signs. Symptoms may not appear until the bleeding becomes serious. Warning signs can include black or tarry stools, vomiting blood, or unexplained fatigue and dizziness. Another major concern is kidney damage. Your kidneys depend on prostaglandins to regulate blood flow and filtration. Ibuprofen reduces these protective chemicals, which can lower blood flow to the kidneys. For healthy people using ibuprofen occasionally, this is usually not a problem. But for older adults, people with kidney disease, diabetes, heart disease, or those who are dehydrated, ibuprofen can trigger acute kidney injury. This risk increases during illnesses that cause dehydration, such as vomiting, diarrhea, or fever. Taking ibuprofen when you are not well hydrated places additional strain on your kidneys, and many people are unaware of this risk. Ibuprofen can also affect your heart and blood vessels. Long-term or high-dose use has been linked to a higher risk of heart attack and stroke. This risk is greater in people with existing heart disease, high blood pressure, high cholesterol, or a history of smoking. Even short-term use can cause fluid retention and raise blood pressure. For people taking medications for hypertension or heart conditions, ibuprofen may reduce the effectiveness of those medications and worsen blood pressure control. Here's something many athletes and active individuals don't realize. Frequent use of ibuprofen may interfere with healing. Inflammation is part of the body's natural repair process. While ibuprofen can reduce pain after an injury or intense exercise, repeated use may slow muscle and tissue recovery over time. Masking pain can also lead people to push through injuries that need rest and proper care. Ibuprofen also interacts with many common medications. When combined with blood thinners, the risk of bleeding increases significantly. When taken with steroid medications, the risk of stomach ulcers and gastrointestinal bleeding rises. Certain blood pressure medications and diuretics can interact with ibuprofen in ways that stress the kidneys and reduce the effectiveness of treatment. Another hidden issue is dosing. Many people believe that if one tablet works, taking more will work even better. But exceeding the recommended dose does not proportionally increase pain relief. It only increases the risk of side effects. High doses of ibuprofen can cause severe stomach bleeding, kidney failure, confusion, dizziness, and in extreme cases, life-threatening complications. Chronic overuse can cause gradual organ damage without noticeable symptoms at first. There is also a widespread belief that ibuprofen is safer than other pain relievers. In reality, every pain medication carries risks. Acetaminophen can harm the liver if misused. Ibuprofen can harm the stomach, kidneys, and heart. Over-the-counter does not mean risk-free. These medications deserve the same respect as prescription drugs. So when is ibuprofen appropriate? Ibuprofen can be useful for short-term relief of pain, inflammation, and fever when used at the lowest effective dose for the shortest necessary duration. It is often helpful for muscle pain, joint pain, dental pain, menstrual cramps, and minor injuries. But ibuprofen is not intended for daily, long-term use without medical supervision. If you find yourself needing it frequently, that may be a sign of an underlying problem that needs medical evaluation and a safer long-term pain management plan. Certain people should use extra caution or avoid ibuprofen altogether. This includes individuals with a history of stomach ulcers or bleeding, kidney disease, advanced heart disease, or those taking blood thinners. Pregnant individuals, particularly in later pregnancy, should avoid NSAIDs unless specifically advised by a healthcare professional. To use ibuprofen more safely, follow a few simple habits. Take it with food to reduce stomach irritation. Avoid alcohol while using it. Do not combine it with other NSAIDs. Stay well hydrated, especially during illness or physical activity. Use the lowest dose that relieves your symptoms and for the shortest time necessary. Most importantly, listen to your body. Pain is your body's signal that something needs attention. Continuously masking pain without addressing the cause can allow injuries or medical conditions to worsen. Ibuprofen can be a helpful tool, but it should not replace proper medical care when pain is persistent, severe, or unexplained. Ibuprofen is not the enemy. When used appropriately, it can be safe and effective. But understanding what you don't know about ibuprofen can help protect your stomach, your kidneys, your heart, and your long-term health. If this video helped you, please like the video, subscribe for more trusted health content, and share it with someone who may benefit.